Did you know that surgery after age 70 carries hidden risks most people never hear about? It's not just the operation itself, it's how your aging body responds to every part of the process. Have you ever wondered why some seniors recover quickly while others face setbacks that affect their independence for months? The truth is, the body after 70 doesn't react the same way it once did. Healing slows, stress weighs heavier, and the effects of anesthesia can linger longer than expected. What if I told you there are simple, powerful ways to prepare so you come out stronger than before? Many older adults who recover smoothly aren't just lucky. They understood what to expect and made choices that gave them the best possible outcome. As we get older, surgery becomes about more than just scalpels and stitches. It's about how your body handles anesthesia, how well your tissues heal, and whether your recovery sets you back or helps you move forward with confidence. If you're between 70 and 85, you've likely noticed the changes. Your body doesn't bounce back as easily, and even minor procedures can feel overwhelming. But here's the good news. With the right preparation, you can protect your health and your independence. In this video, we'll go through 5 essential things you need to know before having surgery in your 70s or 80s. These insights can shape not only your physical recovery, but also your peace of mind, giving you the strength to face surgery with clarity instead of fear. Stay with me until the end, because this isn't just about medical facts. It's about shortening your healing time, safeguarding your independence, and walking into the hospital knowing you've done everything possible to care for yourself before, during, and after the procedure. Let's begin with one of the most overlooked yet crucial factors: anesthesia, and how your body responds once you're over 70. The truth is, the most important part of surgery isn't always the scalpel. It starts the moment you go under. When you go under anesthesia, your body enters a vulnerable state, and how it responds depends greatly on your age, your overall health, and how carefully your care team tailors the medication for older adults. Even a standard dose of anesthesia can remain in the system much longer than expected, slowing down recovery and sometimes leaving you feeling more confused than you imagined. The brain, in particular, is highly sensitive. You may have heard of something called post-op confusion or delirium. This is not just ordinary forgetfulness. It's more like a temporary mental fog that can last for hours, and in some cases, even days after waking up. Some patients feel disoriented. Others become unusually tired, overly emotional, or even agitated. This doesn't mean something went wrong. It means your brain simply needs extra time and support to recalibrate after the stress of surgery. That's why it is absolutely essential to have a real conversation with your anesthesiologist before the procedure. Don't just assume they've read every detail in your chart. Ask them directly, what kind of anesthesia will I be getting? Will it be general or local? How long will it take to wear off? Are there lighter or safer options for someone my age? These questions aren't pushy, they're protective, and they can make all the difference in your outcome. I remember a man named Gerald who was 78 and preparing for a routine hip replacement. He had been through surgery before, but this time he insisted on meeting with the anesthesiologist a few days in advance. Together, they decided to use a spinal block instead of full general anesthesia. The results were remarkable. Within an hour after surgery, Gerald was sitting up, alert, chatting with the nurses, and even asking for lunch. He told me, "It was night and day compared to my last surgery. I felt like myself the entire time." Of course, not every operation offers that option, but you won't know unless you ask. Your medical team should also be aware if you've ever had a negative reaction to anesthesia in the past, even if it happened decades ago. At this stage of life, your age may feel like just a number, but it absolutely matters when it comes to how your brain and body process medications. Choosing the right anesthesia isn't only about getting through the surgery itself. It's about how you wake up afterward, how quickly you're able to move, think clearly, eat, and begin your recovery. Because once you're over 70, those first few hours after surgery can set the tone for your healing, not just for days, but for the weeks ahead. Now let's move to number 2, how pre-surgery preparation shapes your recovery. When it comes to surgery after 70, most people put all their focus on the actual day of the procedure. But in reality, the 2 to 3 weeks leading up to the operation can be just as important, sometimes even more so. Those quiet days before surgery are your golden opportunity to prepare your body for the stress that lies ahead. Seniors who take this time seriously often bounce back faster, face fewer complications, and feel far more in control of the entire process. One of the most overlooked factors is nutrition. As we age, our bodies naturally lose muscle mass, which can slow healing and raise the risk of weakness or falls after surgery. But by deliberately increasing your protein intake in the weeks before, you can give your body a real advantage. Simple choices like adding eggs, beans, fish, or even a high-quality protein shake can help your muscles repair more quickly and strengthen your immune system during recovery. It's not about eating more food. It's about eating smarter and fueling your body with what it truly needs. Sleep is another crucial piece of the puzzle. Many older adults struggle with light or interrupted sleep. But in the days before surgery, deep and restorative rest becomes especially valuable. Your body heals best when it's well rested. Creating a consistent bedtime, turning off screens in the evening, and staying active during the day can all help reset your natural sleep rhythm, ensuring your body has the strength to face the procedure. Movement also plays a key role. Even if you're not used to exercising regularly, gentle stretching or short daily walks can make a surprising difference. These small actions improve circulation, strengthen your lungs, and lower the risk of post-surgical complications such as pneumonia or blood clots. Many hospitals now use the term prehab, which means getting your body ready before it faces something demanding. And it's not just for athletes, it's for anyone who wants a smoother, safer recovery. I remember a woman named Helen who was 76 and preparing for abdominal surgery. Her doctor gave her a simple checklist: increase protein, walk 15 minutes a day, and practice deep breathing exercises. Helen followed it faithfully. After her surgery, the nurses were amazed at how quickly she was up and moving, how stable her vital signs were, and how little pain medication she needed. She later said, "I treated it like training, and I think that's what helped me get back on my feet so quickly." Hydration is another often overlooked tip, yet it can make a world of difference. Unless your doctor advises otherwise, staying well hydrated before surgery helps your kidneys filter anesthesia more effectively, keeps your tissues healthier, and can even reduce unpleasant side effects like dizziness or nausea afterward. Think about it. Something as simple as an extra glass of water can support your entire system during a time of stress. Along with that, just a few extra bites of protein, or even a short 10-minute stretch each day, may seem small. But these little choices can build a powerful foundation when your body is about to face something major. Preparation isn't only about paperwork or packing a hospital bag. True preparation is about giving your body a head start. When you walk into surgery with strength in your muscles, balance in your system, and peace in your mind, you aren't just hoping for a good outcome, you're actively creating one. If you're still watching this video and finding these insights valuable, let me know by commenting number 2 below. And if you haven't subscribed yet, now is the perfect time. Hit subscribe and turn on the notification bell so you don't miss any of our upcoming videos. Your support helps us continue creating content that both informs and inspires you. Now, let's move forward with number 3. The medications and supplements you take matter more than you may realize. Once you reach your 70s or beyond, it's normal to have several pill bottles lined up on the counter. Blood pressure medications, cholesterol tablets, perhaps something for arthritis or sleep. Add in the vitamins and supplements many of us take, just in case, and suddenly it feels like you're running a small pharmacy at home. But here's what most people don't know. Some of these everyday medications can interfere with surgery or affect how your body heals afterward. Certain blood thinners, even common over-the-counter options like aspirin or ibuprofen, can raise the risk of excessive bleeding during surgery. Some herbal supplements, such as ginseng, garlic, or ginkgo, though natural, can have the same effect. Others, like St. John's wort, may interfere with anesthesia or post-op medications. Even something as harmless seeming as a fish oil capsule can influence how your blood clots. This isn't about fear, it's about awareness. That's why, as soon as your surgery is scheduled, you should provide your medical team with a complete list of everything you take. And I mean everything: prescriptions, over-the-counter drugs, vitamins, powders, drops, and even patches. Don't assume your doctors already know. Don't wait for a nurse or doctor to ask about your medications. Be proactive. Say clearly, "Here's what I take every day. Should I stop or adjust anything before surgery?" That one simple step can prevent complications that many people never see coming. I recall a man named Frank, who was 81 and preparing for shoulder surgery. He had been taking turmeric supplements for years to ease joint inflammation. To him, it was just a harmless spice, something natural and safe. But when he mentioned it to his anesthesiologist, they advised him to stop 2 weeks before the procedure to lower the risk of bleeding. Afterward, Frank admitted, "I thought it was just a spice, but that conversation may have saved me from a much rougher recovery." Timing is also critical. Some medications need to be paused a full week before surgery, while others, like heart or blood pressure medications, may actually need to be continued right up until the morning of your operation. Your surgical team must know these details so they can build the safest plan possible around your current health routine. It's equally important to be completely honest about anything you might have recently started. Maybe a friend recommended a supplement, or you picked something up from the health store after reading about it online. Even natural products can interact with anesthesia, prescribed medications, or the healing process itself. There's no shame in asking questions, only wisdom in being cautious. This isn't about abandoning the routines you rely on. It's about making temporary adjustments to give your body the best chance of coming through surgery smoothly and safely. When your doctors have the full picture, they can guide your body through the procedure with fewer risks and help you get back on your feet with far fewer surprises. Because when it comes to healing after 70, there really is no such thing as a harmless unknown. Number 4, the hospital stay and recovery may be harder than you expect, which is why planning for support is absolutely essential. One thing many people don't realize until they've experienced it is just how disorienting a hospital stay can be after 70. The bright lights, constant noises, and strict schedules you can't control all add up quickly. And when you've just come out of surgery, your body isn't only trying to heal, it's struggling to find its bearings again. Seniors who feel blindsided in those first few days often weren't weak at all. They were simply unprepared for how much support they would actually need. Recovery at home in your 70s or 80s looks very different from what it once did. Tasks that used to be simple, getting out of bed, using the bathroom, preparing meals, can suddenly feel exhausting, overwhelming, or even risky. That's why the people who recover best after surgery are often those who prepare support ahead of time rather than waiting until they're in need. They arrange for a family member to stay a few nights, ask a neighbor to check in regularly, stock the fridge with easy meals, and clear walkways to prevent dangerous falls. Having that help nearby isn't just for emergencies. It's because real healing drains energy, and that energy runs low quickly. But support after surgery isn't only physical, it's deeply emotional. Many seniors are surprised by how vulnerable they feel during recovery. You might feel embarrassed needing assistance to get dressed, or frustrated at how long it takes to do something as basic as fixing a snack. For some, unexpected sadness or anxiety sets in, with no clear reason. These feelings are normal, and they are exactly when human presence, not a pill, not a chart, but a person, can make the biggest difference. I think of Carol, age 74, who underwent knee replacement surgery. Fiercely independent, she never wanted to bother anyone. But after a rough first night home, she called her daughter and asked if she could come stay. Together, they built a simple routine: breakfast in the morning, short walks during the day, even quiet afternoons just sitting together Later, Carol admitted, "What helped wasn't the chores. It was knowing I wasn't alone." And even if you don't have family nearby, there are options. Home health aides, senior recovery programs, and even volunteers from local churches or community groups can step in to provide support. Asking for help isn't weakness, it's strength. It shows you're thinking ahead, protecting your safety, and giving your body the time and space it needs to heal fully. Surgery isn't just about surviving the operation, it's about recovering with dignity, comfort, and the peace of mind that comes from knowing you're not doing it alone. So as your surgery date gets closer, don't just think about what to pack for the hospital. Build a recovery plan and make sure that plan includes people. Because even the strongest among us need help when we're healing, and you deserve to recover with confidence, with support, and with the quiet reassurance that someone is by your side. If you're still watching this video and finding these insights helpful, please let me know by commenting below. And if you haven't subscribed yet, I encourage you to do so now and turn on the notification bell so you'll never miss important health information that can guide and inspire you. If you're still with me, let me know by commenting number 4 below. And if you haven't subscribed yet, I encourage you to hit that subscribe button and turn on the notification bell so you won't miss any upcoming videos. Your support allows us to keep creating content designed to inform, guide, and inspire you. Now let's move forward with number 5. Your mindset before surgery has a powerful effect on how your body heals. One of the most underestimated aspects of surgery after 70 has nothing to do with charts, lab results, or medical equipment. It has everything to do with the way you think, feel, and prepare yourself emotionally. This isn't just about being optimistic. It's about focus, intention, and clarity. When your mind is scattered, weighed down with stress, or clouded by fear, your body carries that burden too. And that burden can slow down every stage of recovery. On the other hand, when your thoughts are calm and steady, your body tends to respond with greater resilience. In fact, a growing body of research shows that mental and emotional preparation can reduce complications, shorten hospital stays, and even improve how people tolerate pain. Seniors who go into surgery with confidence, calmness, and a clear plan are often able to move through recovery more smoothly. By contrast, those who feel rushed, anxious, or confused, even if the surgery itself goes perfectly, are more likely to experience setbacks. That's why creating a small mental routine in the days before surgery can be so helpful. This could be as simple as visualizing a smooth recovery each night before bed or writing down a few small, achievable goals. For example, I want to walk to the mailbox by day 3, or I want to eat breakfast sitting at the table by day 4. These little anchors give your mind something steady to hold on to, even when your body feels like it's still catching up. There's also real power in naming your fears. Many older adults hesitate to say things like, "I'm scared," or "I'm afraid I won't bounce back." But voicing that fear, even once, makes it easier to process and easier to move beyond. You can share it with a trusted friend, a family member, or even your surgeon. And when you do, you may discover that others have felt the exact same way. That simple acknowledgement can be incredibly comforting. I remember Howard, who was 80 and preparing for heart surgery. Physically, he was in excellent shape, but mentally, he was shaken. So, he began journaling, just a few sentences every morning, to put his thoughts on paper and quiet his worries. Howard wrote about everything, his fears, his hopes, even the things he wanted to do once he recovered. After the surgery, he told me, "My body needed time to heal, but my mind already knew where we were going." His words are a reminder that healing isn't only about stitches and medications, it begins in the mind. Never underestimate the power of calm practices like meditation, prayer, journaling, or even simple breathing exercises. Anything that helps you find stillness can shift your nervous system out of stress mode and into healing mode. When you walk into surgery with a centered, peaceful mind, you give your body the very best chance to follow. Because true healing is not just physical, It is also mental and emotional. And the strongest recoveries often begin with a quiet kind of courage, the kind you gift to yourself long before the first incision is ever made. As we wrap up this video, I want to leave you with something simple yet powerful. Surgery after 70 does not have to feel overwhelming, frightening, or beyond your control. In fact, the more you understand what lies ahead, the more confidently you can face it. And confidence, calm, quiet, informed confidence, is one of the strongest tools you will ever carry with you on the road to recovery. Whether it's asking the right questions about anesthesia, nourishing your body with more protein, adjusting your medications wisely, or simply creating a recovery plan that includes support and rest, every step you take in preparation is a step toward a safer, smoother, and stronger healing journey. So as you prepare for surgery, remember this: you are not powerless, you are not alone, and you are far stronger than you may think. Wishing you health, peace, and the courage to step forward with clarity. And don't forget, subscribe to the channel so you can continue receiving guidance and inspiration for every stage of healthy senior living. By focusing on protein beforehand, adjusting your medications wisely, setting up the right support for recovery, and calming your mind, you are not helpless in this process. You are an active partner in your own healing. Each of these 5 steps is a reminder that you are not walking into surgery blindly. You are walking in with intention, with awareness, and with a strength that doesn't come from denying your age, but from honoring it. Yes, surgery may slow you down for a little while. That much is true. But with the right preparation, it doesn't have to set you back. Instead, it can become an opportunity to come out stronger, steadier, and more at peace, knowing you did your part to make recovery easier, smoother, and more meaningful. So take a deep breath, write down your questions, reach out for support. Step into this next chapter with your eyes wide open and your heart steady. Because the truth is, you are not alone in this journey, and you never have to be. Thank you for joining us today. We would love to hear from you. Share one thing you learned from this video and how you plan to apply it in your life. Your thoughts truly matter, and reading your comments gives us great motivation and encouragement. If you found this video helpful, please like, subscribe, and share it with others. Your support helps us continue creating valuable content to inform, inspire, and guide you. Wishing you good health, happiness, and peace. And don't forget to subscribe to our channel so you never miss what's coming next. We look forward to seeing you in the next video.